So now you know what is diabetes and what are the tests you got to do to figure out whether you are a diabetic. Yeah. Now you're wondering, what if I don't get tested? Yeah. Hello and welcome to the third episode of this series of 10 questions that you need to ask yourself. And yes, to your doctor, if and when you get tested for diabetes or whenever you get an opportunity to do so. Yeah. So the question number 3 would be, yeah, I know basically what diabetes is. I've got tested for it. But then, do I really need to get tested? What if I don't? What are the health problems if I don't get tested? Okay. I'm Dr. Satish Bhat, consultant diabetologist, and this is Diabetic Care Global. Thanks for watching and thanks for being with us. Yeah. So we dive deeper into this subject of diabetology. I'll keep it as simple as possible. Technicalities are all available on the net. I don't need to bore you with that, right? So I'll keep it as simple and as basic as possible. So you have figured it out. Yeah, now you are left wondering whether I really need to get tested. Yes, you do need to get tested. But why? That is the question. Why spend a bomb on something that can be managed or believed to be managed only with a glucometer reading? Wrong. Diabetes is much more about than merely blood sugars. Blood sugars don't directly kill anyone other than in extremely low levels. Yeah. High blood sugars don't directly kill you. It's the complications of these that can be extremely dangerous and even fatal. The complications of diabetes. And the complications, now comes to the most important part of this. The complications set in even before the symptoms actually happen. You shouldn't be waiting for symptoms of these problems. We need to figure out what are the complications that have started showing up and how to slow them down or, if possible, reverse them. Yes, some of them can be reversed. So, what is the basic issue that we are dealing with here? Diabetes is the disease that affects the smallest blood vessels of the body. And this involvement of the smallest blood vessels of the body starts much before the symptoms show up. These changes can be picked up very early on. That is the importance of testing in diabetes, testing beyond blood sugars in diabetes. You need to get tested for your cholesterol levels. You need to get tested for your kidney functions, liver functions. All these need to be done for the situation or for the condition of your blood vessels, for the condition of your nerves. Now, blood vessels, what do? You get your eyes checked. Very simple, but extremely valuable information. These are the sorts of tests you need to do. We'll be talking about them in the coming episodes. Right now, I hope you understand the fact that diabetes is not merely about blood sugar. This is one message that will be repeated because this is the problem not with just the public, it's also a problem with us because we need to make people understand that we need to go beyond the glucose-centric viewpoint. Glucose-centric is the viewpoint, the perception that only the blood sugars matter. Have you at least heard of a few people in your circle dying of diabetic complications? Very often the complication could be cardiovascular, which is the commonest, and neuropathy related, and blood supply related, that's a vascular related, wherein you lose your limb, you lose a part of your body forever. You lose your eyesight, or someone has lost kidney functions. Haven't you heard of that? What happens there? It is the microvascular problem. The smallest blood vessels are affected. That's what causes the maximum mortality, that is the death rate, as well as the morbidity. Morbidity is the fear, the deep anxiety, the deep apprehension that all these conditions bring about, not just in that individual, even in the family and the community. So that is the point we are trying to make here. Thanks for watching.